Hello and welcome to Nurses Handbook. Today I bring to you some MCQs on nursing research. Question number 1. Probability sampling includes all the following techniques except option number 1. Systemic sampling, option number 2. Simple random sampling, option number 3. Purposive sampling, and option number 4. Cluster sampling. And the correct answer is option number 3. Purposive sampling. Purposive sampling is also known as judgmental, selective, or subjective sampling, and this is a form of non-probability sampling. In this, researchers rely on their own judgment when choosing members of the population to participate in the study. Question number 2. The terminology used to explain the number of subjects recruited to participate in a study and it declines during a course of a project or the study. Option number 1, variability. Option number 2, heterogeneity. Option number 3, homogeneity. And option number 4, attrition. And the correct answer is option number 4, attrition. In simple terms, attrition is the loss of study units from a sample. In a study, attrition rates may vary across time periods, data sources, and outcomes. Question number 3. The evidence to assert whether or not the experimental treatment or condition has made the difference refers to option number 1. External validity, option number 2. Internal validity, option number 3. Criterion validity, and option number 4. Construct validity. And the correct answer is option number 2, internal validity. Internal validity means to establish a trustworthy cause and effect relationship between the treatment and an outcome. For an example, if I conduct a study and in the study I implement a smoking cessation program within a group. So how sure I am that the improvement in the group has occurred because of the program which I implemented? That surety is known as the internal validity. Question number 4. The subject in a research study behaves in a particular manner because they are aware that they are being observed. This is called option number 1, Hawthorne effect, option number 2, experimental effect, option number 3, reactive effect, and option number 4, novelty effect. And the correct answer is option number 1, Hawthorne effect. Hawthorne effect is also known as the observer effect. Question number 5. Best strategy to promote research utilization among nurses is option number 1, train and equip nurses with the knowledge of the evidence-based practice. Option number 2, research collaboration among nurse researcher and nurses clinicians. Option number 3, motivating nurses to read and review and participate in research. Option number 4, all of the above. And the correct answer is option number 4, all of the above. Research utilization framework consists of 4 phases, that is the foundational phase, the research phase, the translation phase, and the institutionalization phase. Question number 6. Which of the following communication channel is appropriate for dissemination of research findings to largest target group? Option number 1, thesis and dissertation. Option number 2, oral poster presentation in conference. Option number 3, newsletter. And option number 4, scientific journal articles. And the correct answer is option number 4, journal articles. Dissemination refers to the process of sharing research findings with stakeholders and wider audiences. There are a wide variety of dissemination methods like newsletters, flyers, and press releases can create awareness about the project or the research, whereas reports, journal articles, and websites can transmit information to a wider range of audiences. Conference presentations is another way to promote the project or the research. Question number 7. Which of the following type of research focuses on finding a solution to an immediate practical problem? Option number 1, basic research. Option number 2, applied research. Option number 3, explanatory research. And option number 4, descriptive research. And the correct answer is option number 2, applied research. Applied research is a type of research design that seeks to solve a specific problem or provide innovative solution to the issues affecting an individual group or society. There are 3 types of applied research. First is evaluation research, second is research and development, and third type is the action research. Question number 8. Study that produce basic estimates of the rates of the disorder in a general population and its subgroup is referred as. Option number 1, qualitative epidemiology. Option number 2, analytic epidemiology. Option number 3, experimental epidemiology. And option number 4, descriptive epidemiology. And the correct answer is option number 4, descriptive epidemiology. Descriptive epidemiology is a type of epidemiological research that provides information on disease patterns by considering various characteristics of person, place and time using descriptive statistics. Question number 9. The first annotated index of nursing research was the work of. Option number 1, Dorothea Orem. Option number 2, Florence Nightingale. Option number 3, Dennis Pollitt. And option number 4, Virginia Henderson. And the correct answer is option number 4, Virginia Henderson. Question number 10. Cohort study is also known as. Option number 1, prospective study. Option number 2, forward-looking study. Option number 3, incidence study. And option number 4, all of the above. And the correct answer is option number 4, all of the above. Cohort studies are a type of longitudinal study. In this, the researcher follows the participants over a period of time. Question number 11. The most objective approach to obtain nursing knowledge is through. Option number 1, experience. Option number 2, textbooks. Option number 3, trial and error. And option number 4, scientific research. And the correct answer is option number 4, scientific research. Thank you for watching. For more updates like this, do like, share and subscribe to our channel Nurses Handbook.